often have you seen this during the pandemic? Someone takes your temperature before you're allowed into a business or an office. It's pretty routine. In fact, for over a year, it's been used as a method of screening people for COVID. But as the I-Team's Joel Grover shows us, some medical experts now say it's useless, even misleading, to take temperatures.
You still see it at doctors' offices, hospitals, gyms, even major attractions like the Long Beach Aquarium still require temperature checks and will turn away anyone with a temperature over 100.4. Are temperature checks giving us a false sense of security?
Yes.
Dr. Jeff KLAUSNER, a preventative medicine expert at USC's KECK School of Medicine.
Temperature screening will miss many people with infection.
That's confirmed by this CDC report, which looked at the screening of more than 700,000 travelers entering the U.S. last year based on temperature and symptom screening. Those methods found only one COVID case per 85,000 travelers. The report concluded that symptom-based screening programs are ineffective.
Temperature screenings are problematic because many times people can have COVID without any fever.
In the beginning of the pandemic, it was thought that COVID patients usually had high fevers. But studies now show many COVID-positive patients have normal temperatures.
I'm going to take your temperature.
And the I-Team exposed another big problem with temperature checks. Last summer, we tried out 5 popular no-touch thermometers sold online with the help of registered nurse Alice Benjamin.
The normal is 98.6.
A professor at the Charles R. Drew University of Medicine and Science. Using a standard oral thermometer, my temperature was in the normal range, 98.5. But 2 of the no-touch thermometers we tried were almost 3 degrees less.
This one says 95.7.
Is that difference concern you?
Well, as a healthcare professional, it does.
And we found medical experts who also question the accuracy of no-touch thermometers, like Dr. James LAWLER of the Global Center for Health Security at the University of Nebraska.
Those devices in general are less reliable and less accurate.
So now the CDC is saying temperature screenings are ineffective, but LA County's public health department is still recommending them. Why are we seeing so many businesses, doctors' offices still doing temperature checks?
Well, I think people got in the habit, and it's tough to break a bad habit.
The state plans to end most COVID protocols like mask wearing and social distancing on June 15th. But as far as temperature checks go, the Department of Health tells the I-Team it will provide more guidance closer to June 15th. For the I-Team, I'm Joel Grover.